What's the 7-step GLP-1 muscle loss cycle that's wrecking women's bodies today? Step 1. A woman starts a GLP-1 weight loss journey focused on rapid weight loss and most likely on a dose that's way too high. Step 2, her appetite disappears. She eats too little, her nutrition's terrible, and she's not strength training. Step 3, the scale goes down, but a significant amount of that weight loss is muscle. Step 4, with less muscle, her metabolism slows. Step 5, she stops the GLP-1 medication. Step 6, she now has less muscle and a slower metabolism, which means she needs to eat even less to maintain her weight, so she gains all the weight back and she's in a worse place than where she started. Step 7, she blames herself, and the cycle repeats. The good news is this is completely preventable when you understand how to take a holistic approach to a GLP-1. And we're incredibly fortunate to have Dr. Zhenqi Liu with us today. He's a physician, endocrinologist, and professor of medicine at the University of Virginia, and one of the world's leading researchers studying how GLP-1 medications affect metabolism and muscle. Today, he'll explain how to use a GLP-1 without losing muscle. I'm Elizabeth McGann, your guide to doing GLP-1s the right way. To take our free masterclass, How to Microdose a GLP-1 Holistically, just click the link in our episode description. Hello, hello.
Yes. Hello.
Hello, hello. Right now, a lot of people are using GLP-1s just to eat less and lose weight quickly. From what you see, what can go wrong when that's the only focus?
What could potentially go wrong? Let me just cite a warning from the American Diabetes Association. I mean, you're a nutritionist, you know this quite well, is that when we don't eat, we are facing two major issues. One is we may have issue with malnutrition, right? If we don't eat enough nutrients, and when we suppress our appetite, don't eat enough nutrients, we're going to have issues with potentially malnutrition.
I'm so glad you brought that up. Just real quick, is that, they talk about Ozempic face?
That's a little bit different. The Ozempic phase is a little bit different is because when we lose weight rapidly, and we have redundant skins. So that's more or less, sort of cosmetic appearance. But when we talk about malnutrition, is more or less normally we need to eat a balanced diet with adequate ingestion of different type of nutrients. And when we drop our appetite, so not only we don't eat carbs, proteins, fat, but also other macronutrients as well. So there's a possibility of a nutritional deficiency in our body. And so this is one of the major issues. And another potentially major issue that can potentially go wrong is excessive muscle loss.
Yes.
In our body. Again, this has something to do with the medication as well. But not that specific. So overall, if we decrease our appetite, so that not taking enough nutrients, including mostly proteins, carbohydrates, and the fat, and we're going to lose weight. So when we lose weight, there's one potential negative impact is our body needs certain nutrients, particularly, when you talk about particular amino acids, in order to renew our cell metabolism, to keep our cells sort of healthy and functional. So where do we get the amino acids? If we are not eating enough, our body takes from somewhere else from our body. And
from the muscle.
Naturally from the muscle. And the muscle is the easy target because muscle has the most, muscle not only function as a maintain our body posture, but also function as a storage for amino acids as well. And so our body takes the, amino acids from our body reserve and naturally comes from the muscle. So that could potentially go wrong, particularly in people who have reduced amino acid reserve or muscle reserve. So in people with overweight or obesity, we tend to have a lower muscle mass, right? Either relative muscle mass or absolute muscle mass sort of reduction.
Wait, can I ask a question though? Because with you, if you've got 50 extra pounds on you or more, don't you have extra muscle to hold that all up though?
Yes, you are absolutely right. So when you have whole body sort of size goes up, and most of them are sort of fat mass, but there also muscle also increases. But there is one problem with that amount of muscle. Is number one is the relative amount is not enough to support the actual body weight.
So if what you're saying is if people are eating too little, they're going to pull that protein, those amino acids from their muscle, and they don't have enough muscle to do that.
Yes. And also in people who's overweight or obese, and also the muscle quality is not as good.
What's the muscle quality mean? Isn't muscle muscle? Like, isn't skeletal muscle, or is there different types of skeletal muscle?
Well, there's different, they're the same amount, same types. So we typically have type 1, type 2 muscles, so mixed muscles. So the types are the same. But when talking about quality, it's more or less we're talking about a functional difference.
How strong that person is?
Exactly.
Okay, if they're using their body well.
Right. So when we have normal muscle function, our body tend to be more, we tend to have more strength. When people with increased sort of adipose tissue in our body, what happens is our body tend to store some fat in the muscle.
In the muscle?
In the muscle, yes. In the muscle, not just in the, in something we call adipose tissue, but also in the muscle. And when you have increased the muscle, fat in the muscle, your muscle strength actually decreases. And our muscle tend to not respond to insulin as well as normal sort of non-obese people do. And also, there's some strong evidence suggesting the mitochondria, which is the energy powerhouse within their cells, functioning not up to the par of those who's well-trained, who's healthy without obesity. So you're talking about both quality and the quantity issue.
Oh, gosh, that's so helpful to know. So people that are carrying extra weight, the quality of their muscle itself is poorer, and the way the insulin works, it makes it worse when they're losing weight. It doesn't respond.
Well, when they lose weight, that's further different issue. So when they lose weight, before they lose weight, so their response to insulin is decreased, and their function is decreased. When they lose weight, eventually, over a shorter period of time, they may respond better to insulin, and the muscle strength may improve over a shorter period of time. But over the long run, if you have absolute muscle loss, then you kind of potentially negate those positive effects. So that's why it's important to pay attention. When you're losing weight, you really need to make effort to rebuild your muscle.
Oh, yes, 100%. So I just want to know, our listeners, they're listening, they really want to do GLP-1s the right way. And they've heard that, that it's important to strength train. It's important to use the muscles so you don't lose muscle mass and you lose more fat. I'm curious, just your background with patients. Are you in more of a researching mode? Do you work one-on-one with patients as a prescribing doctor for GLP-1s?
Yes,
do you help people lose weight?
Yes, I do. So actually I do. And in the clinic, when I talk to patients, I actually spend more time with patients talking about the potential, what could go wrong, and what should we do about it, instead of just purely tell people that, you're going to lose weight with the medication, and good for you, and you should, keep the medication for so long. But I actually spend a lot of time talking about what could potentially go wrong, and particularly for those people who are at risk of lower body mass index, and who's at risk for low muscle and particularly for those elderly people. And when people get in the 60s, 70s, I get really nervous about those aspects. So I could just spend a fair amount of time talking to them on those aspects.
Oh, that's so good. I'm so glad you talked
Yeah.
to them about it. So when you talk to them, what do you emphasize? Do you emphasize strength training and resistance training? Do you make sure that they're doing it?
Yeah.
What do you tell them to do? If someone's listening, how much exercise do they need to do?
So what I usually tell people is, certainly I tell people how to use those medications first, and make sure people stick to the prescription. And once that is all said, I started talking about what people should do. First of all, when I select patients, I don't put everybody on GLP-1 receptor agonist. I look at their risk, and for malnutrition, look at their risk for potential aggravated muscle loss, and if they are at those risks, I would rather hold those medications or at least delay the treatment until things improve. And
Yeah.
after screening, if I don't have those concerns, and I would tell people to immediately start a couple of things. Number one is make sure they begin a routine exercise program. When I talk about routine exercise program, it includes two components. One is the resistance training, and you probably should do at least 2 to 3 times a week, okay, at the least. And the resistance training helps build muscle, make our muscle stronger. But I also emphasize the utility of aerobic exercise. So we typically recommend at least 150 minutes per week of either moderate or high intensity aerobic exercise, because the aerobic exercise is not as effective as resistance training in building muscle, but it actually improves our exercise capacity, which is really important. So this is another concept called cardiovascular fitness, and which is independent of BMI, independent predictor of cardiovascular and all-cause mortality. We're overweight or we're lean. If we have low cardiovascular fitness, our mortality rate is much higher. You're talking about 2 to 3-fold higher.
So the cardiovascular fitness is very important. While it won't build muscle per se, it helps with the overall results.
Yes. Part of the thing is people with obesity, they tend to have a lower cardiovascular fitness from different reasons. And so the aerobic exercise helps to improve that. So this is an exercise I tell people to do. And also, I also want to make sure nutritionally they're well-rounded. Yeah.
Well, let's talk about that. I love hearing about doctors talking about well-rounded nutrition. What are some some of your best tips for nutrition, and how important is protein?
So the best tip about nutrition is, number one, eat a balanced diet. So that would include all nutrients. Try not to pick one and neglect the other. And our body needs all sort of nutrients. So we eat a balanced diet. This is very important. And number two, before we get into specific, and I always warn people, even if you don't feel like you need to eat, particularly when you're under medication, particularly high dose for too long, and many times their appetite do tank. So people don't eat. And that could be problematic because you're not going to get sufficient nutrients. So
That's terrible.
Yeah. So what I usually tell people is, all right, even if you're not you don't have the appetite, mark your calendar, eat at a specific time. Though you may not eat much, but at least you're going to take in some nutrients. So this is a kind of two tips, but specific to the nutrients. And I do emphasize sufficient amount of protein intake. And which is really important in building the muscle. So
Yes.
there are a lot of different recommendations, but on average, it's roughly between 1 to 1.5 kilogram per kilo per day. So you're talking about maybe roughly, I think back on the envelope calculation, probably 20 to 40 grams per meal and 3 meals a day. And that really helps in preventing the muscle loss because protein provides amino acids to our
Yes.
body. And amino acids has two very distinctive functions. One is as a building block to build the proteins. And the number two is it stimulates the amino acids or protein building signaling cascade. So it's a building block. It initiates the whole process. And when you couple the protein intake with exercise, it's actually work much better
Yes.
than either alone.
Question.
Yes.
I've heard some people say that eating protein alone can build muscle. Is that true?
It is true for a short period of time. So you eat a muscle, as I just said, it provides a building block and it stimulates the protein synthesis that cascade or process. So over short term, you can improve sort of build muscle mass, but over the long run, the effect is not well studied.
And I'm glad we're talking about proteins because our audience is rather sophisticated when it comes to the protein conversation. And I want to just actually even grab this supplement that I have on my counter just to ask you a specific question. So the protein conversation, a lot of people know that they're supposed to eat protein and a well-balanced diet. And I love that you emphasize that because we need all the nutrients, all the micronutrients. We need a healthy, balanced diet. And with protein, though, how to get it, a lot of times people, especially on these GLP-1s, they're not hungry. So they're under eating. So a lot of times people are taking their protein in protein powders or in like protein drinks, and they want to supplement proteins. Let's just talk about this. What's the best protein sources? Is animal protein better than plant-based protein? Let's start there.
I think it really depends on your perspective. There's some evidence suggesting plant protein might be better.
Really? Plant?
Yeah, might.
Okay.
But I would say the evidence is not as strong as it has been advertised. And so I usually don't recommend a specific the protein source, but I do emphasize probably the best source is lean meat, eggs, fish, nuts, those type of things. They have a lot of a variety of proteins, and certainly coupled with plant proteins. So I personally like to recommend people eat a variety of different foods that include both animal and plant proteins. For people who have really, really low appetite, don't want to eat at all, and so those protein supplementation, it helps. So protein powder, just to make sure that they eat a certain amount every day, it does help. So
is it better to get it from real food versus a protein powder? Does the body handle real food proteins more than a powder?
Well, not necessarily. Our body should have the capability to digest the proteins if our digestive system is, functioning normally. So compared to the powder, whatever protein we eat is going to be digested into small peptides or amino acids getting absorbed and our body using it as a building block. And the effect should be pretty much the same. But I would rather emphasize the whole food simply because of the point I try to make of a balanced diet. And when you talk about the meat or egg, other than protein, it has other nutrients as well.
Yes, very much so. And so sometimes when I'm working with a client who's a vegan or a vegetarian that doesn't eat meat, they have a harder time figuring out how to get the right amount of protein. And there's some products out there, supplements, they're amino acids. And like there's a brand called Perfect Aminos. And when you look at it, it shows that there's really only about 2 grams in the serving because it's all the amino acids, essential amino acids, that it's as if you're taking 20 grams.
Right.
Is that true? Is an essential amino acid like when you're just taking leucine, lysine, tryptophan,
Right.
etc.? Would essential amino acids translate in as if you had 20 grams of protein in a meal?
It's kind of yes or no question. And the reason why I said with ambiguity here is the reason why we call it essential amino acids is that our body does not have the capability to produce those amino acids. For the non-essential amino acids, our body actually can synthesize them from other sources. So that's why one called essential, one is called non-essential. And when you have enough essential amino acids intake, and our body can couple with other amino acids resource to make proteins. So that's the major difference. So if you don't want our body to synthesize from other sources, then take some non-essential amino acids is also important as well. I think the key issue actually, to me, is more or less how much do those things cost. There are a lot of protein supplements over there, and some of them may cost people arm and a leg, depends on how long they take.
I see.
Right, and in reality, probably many times are exaggerated to some degree. To me personally, I would think again the most important thing is take enough and balanced.
If someone's a vegan or a vegetarian, what would you recommend? Would you tell them to supplement with essential amino acids?
I would recommend a supplement with a protein diet, protein powder, rather than with the essential amino acids.
Okay, so you don't think essential amino acids are that important?
Well, it is important because we have to have them.
Right,
Again,
but to supplement with them.
Well, to supplement with excessive, probably is not as important as eating a balanced diet with a sufficient amount of all amino acids.
Right, but if they're a vegan, like they're just eating plants all the time, it's hard to get 20 grams of protein a meal.
Well, then they can just add sufficient amount of protein from the protein powder.
The plant protein.
Yeah, plant or plant protein should be fine.
Yeah, and it's interesting that you said, because that's news to me, that I always heard that animal-based protein was more, the body worked with it better to build muscles, that plant-based protein was harder to metabolize and maybe not as efficient in building muscle. And you're saying the opposite. Well,
I'm not saying the opposite. What I'm saying is the evidence over the long run, the benefit is probably not as obvious, the difference.
Okay.
So our body has, humans kind of digest system, kind of like animals, right? And so probably it's easier to digest animal protein. And for the plant proteins, our body can also digest it and might not be as efficient, as animal proteins or meat. But so long as we take enough, so my point is probably, so long as you take enough that your body needs.
Yes, very good.
I personally, you can get it from whatever source.
Yes, a balanced diet. I agree. I'm curious, Dr. Liu, what do you think of GLP-1s? Do you feel like they're good for people? I know, it's not just one size fits all, but in general, are you a fan of this medication?
Let me put that way. Depends on different purpose. If from weight loss perspective, I'm a fan of lifestyle modification. And because that's a more natural way of losing weight. And certainly it requires a lot of willpower to engage someone for extended period of time of exercise and diet control. But it works.
Yeah.
It does work, and also the negative impact on our body is not as sort of potentially big as GLP-1 related medications. I am personally a big fan of GLP-1 receptor agonist, and for many perspective. And certainly weight loss is one of the major benefits from the medication, but on the sort of above the weight loss, it's also very effective for people with diabetes. You're talking about type 2 diabetes in controlling their blood glucose and improve their cardiovascular outcomes in people with diabetes and potentially also in people with obesity as well. For those reasons, in a combination of cardiovascular risk reduction, weight loss, glucose control. So I am a big fan of it. And that's why I dedicated my career working on to understand the GLP-1 and the GLP-1 receptor agonist that also drugs.
Yes. We're grateful to you for all the research that you do. And I love that you said that behavioral change is really important. It's an important driver in long-term weight loss.
Absolutely.
In the work that I do with clients, when they're working with their doctors, I like to help them think about how to do behavioral change with the GLP-1 and often low doses of GLP-1s. We're finding out here in California where people tend to be a little bit ahead of the curve. I've noticed that they're even microdosing GLP-1s or taking really sometimes staying at just the first starting dose and not really going much higher, letting the behavioral change and the lifestyle do most of the heavy lifting instead of just dosing up higher and higher and having all the side effects. What are you seeing with that? Do you feel like a GLP-1 could be an important part of someone making behavioral change?
I would say yes. And particularly in those people who are motivated to lose weight. And, if they are motivated in making behavior change, they may need sort of less help from medication. Typically what I do is after I assess people's motivation, I put the people on sort of starting dose of GLP-1 receptor agonist, and I would observe for a couple of months. And depends on how they respond. If they tend to lose a significant amount of weight, I keep them at a lower dose. Because at the higher dose, you have a higher chance of potential negative impact we just talked about, right? So keep them on the lower dose until, certainly in people who need a higher dose, I go up with the dose. But if they don't need that, I adopt the principle as little as possible. You're talking about medication, so.
Yeah. Yes. Well, it's funny. It sounds like common sense to have like the least amount, the minimum effective dose. It seems like common sense. That said, it often looks like for some people that are on them, they just are advised to go higher and higher.
Well, I kind of understand that part, and that's based on the clinical trial data. So we only have certain dosages getting tested in clinical trial, right? So if we for Wegovy, if the dose test is 2.4. And getting sort of the effect, then people tend to go up. And also I think one of the caveat is we are all under the impression that including patients who are taking it and also physicians, in terms of weight loss, they're fast, they're better, they're more, they're better.
No, but right. Do you think that? Do you think,
No.
don't people? Yeah.
No, you can't do that. Then people say, oh, I lost 30 pounds. And that might be too much for a person over a short period of time. Right. So really, when we lose weight, we needed to adopt an approach that, gradual approach works the best. And that's particularly, and also, sort of adequate amount. I mean, each individual is different. And, too skinny probably is not good for anyone. And also another problem with too fast and too much weight loss, not only is, increases the risk for muscle loss and malnutrition, and once you stop the program, people tend to regain most of the weight back.
Especially if they don't change their behavior.
Exactly. So that's why I always emphasize behavior change. If you don't change your behavior, you just put people on those medication, they are happy, They're calling you a good doctor and you're the best because I lost 20 pounds in 3 months. Yeah, and once you stop it and without concurrent behavior modification, you still, exercise and your appetite started coming back. And there are some studies showed if that happens without exercise, people actually tend to gain more fat back than the combination of fat and muscle. And that's actually quite problematic. As I mentioned, that people with obesity tend to have relative muscle loss and they tend to have lower cardiorespiratory fitness, right? And if you gain more weight, fat back, you don't gain sufficient muscle back to support this fat. And what happened to your excess capacity? It drops further. So that could be problematic.
Oh, yes, because then they gain the weight back and now they have less muscle and more fat. Their metabolism actually works less efficiently.
It's getting worse.
Yeah.
It would get worse.
So that's a problem. And how do you measure muscle loss? Do you in your practice, do you do a body composition analysis? Do you do a DEXA or a InBody?
Well, in my research, I do.
Mm-hmm.
In research program, I do measure people's body mass composition using DEXA scan and look at their excess capacity. But those are too complicated for clinical practice. There's no way you can do it in the clinical setting, and we don't have the equipment and we don't have the time to do all those things. So what I usually emphasize to people, weight loss is important, but the strength assessment is even more important. So I do assess people's strengths in the clinic. So how much they can walk? You're talking about 6-minute walking test. How fast can they walk? Their gait, or their gait, gait steady. And if I ask people to sit down and stand up within 15, 30 seconds, how many sit-ups can they do? So all those can be used to assess the muscle strength of different muscle groups.
I see. So you do it more without clinically, when you're working one-on-one with a patient, you'll do it more as an assessment, like you just said, versus a DEXA.
Right.
Okay. And if someone tells you that they're not working out or strength training and resistance training, will you stop the medication or?
Well, if they're on the medication, I probably would not stop the medication for fear of weight regain, and I would emphasize again the importance of exercising, and I would also emphasize even more the importance of nutrient supplement.
Yes.
In terms of protein supplements.
Yes. And so what I'm hearing you say is that strength training for muscle is critical, and you have to be doing it at least 3 times a week.
Absolutely. Yeah.
Yeah. And ideally, if someone wants to do it 100% the right way, they don't want to mess around. Would you say they should be doing something every day? Or is there too much exercise? What would be, if you could wave a magic wand and make someone do what you say, what would you say?
Well, I would say, particularly for people who get into a certain age, do not oversert your body. Okay. Do as much as you can, because every little bit helps. And certainly for people who are able, and I do ask people to do resistance training 2 to 3 times per week, and aerobic exercise minimum 150 minutes per week, and without too much interruption. If you can do it every day, that's even better. But we know everybody is busy, and then it's can be hard to do it every day. So do as much as possible, but don't overexert, and do as much as your body can tolerate. And this is critically important for people who get into a certain age, who are not as strong, because you don't want people to fall, you don't want people to break their bones. And so it's kind of, you have to have a balanced assessment.
Start slow.
Yeah.
Start slow and low and build. Don't jump right into something.
Yeah, bit by bit.
Bit by bit.
Yeah.
Yeah. Okay. So what would you say for people there's a lot of people and that are relying only on the medication? What's the one mistake that you see people doing with that when they're relying only on the medication?
So if people are only relying on the medication, I frequently see 2 actually common mistake. One is not making lifestyle modification, and including exercise and nutritional, sort of supplementation. And another one is people tend to use the medication and stop, and use and stop. And it depends. I mean, certainly sometimes it's out of their control because of the insurance issue, finance issue, and all different things. But actually, I see a lot of people who take the medication and stop, take the medication and stop. And it's actually a common phenomenon in particularly in elderly population. People tend to take it, stop it, take it, stop it. So as I just mentioned, that type of yo-yoing could present with a major issue with you lose weight, including muscle, and you don't do sort of exercise or nutrition supplement. You stop the medication, you regain the weight, and you actually gain potentially more fat, the muscle, and you start yo-yoing. So the possibility is, your muscle mass may continue to decrease without affecting much your body weight. So you actually make your body composition even worse down the road.
That is not what we want to do.
No.
I mean, that's just
many people, they're happy. It's like, oh, I lost 30 pounds, then I stop. And then, after a couple of months or a year, they say, oh, I gained that all the way back, and then they start medication again. So it is a type of yo-yoing. I mean, this is not really specific to GLP-1 related drugs, and even with other weight loss modalities, and it happens to that as well, including purely diet induced weight loss, or sometimes even with that's not that much yo-yoing with the bariatric surgery, but also those approach also produce a significant amount of weight loss, and including muscle loss.
To end on a positive note, if someone wants to use GLP-1s in the healthiest way possible, what's the one thing you'd want them to understand?
I would say GLP-1 is a related drugs. They are very effective in losing weight, and it has potential downside. And and you cannot use the medication in place of lifestyle modification. I think you have to have both.
That's it. That is it. Your words, your words to God. You have to have both. It's so important. And I think they could even use the opportunity to be on a GLP-1 to change their whole life, to change their eating, their exercise, their stress. And it seems like you really are helping people with that.
Yes, that's really important. That's why in the clinic, actually, when I give people the prescription, I can just spend more time talking about other aspects.
So important. So important. I really hope people are really taking notes and listening. This is, it's holistic. It's a behavior change. And those are the people that get the best results. And the people that don't do that, it's pretty scary.
No, it is. It is. So you have to use it, sort of adequately. And
yes.
That's why we call the medications. Another term is drugs, right? It has positive side and also negative side. We have to weigh the benefits versus risk.
Oh, absolutely. And Dr. Liu, I know you do so much with your research and your physician working with patients and endocrinologists. Right. You're studying so much. What are you excited about? I know you said this is your life's work. Tell me what's coming up for you in the next 18 months.
So we actually trying to 18 months, probably 18 months to the next 5 years. So one thing getting me really excited is, well, I've been studying GLP-1 and GLP-1 related drugs for the past 20 years, and I'm so excited the progress we have made over the past 2 decades. Particularly in terms of the diabetes control, weight reduction. And I see the change, particularly in people with type 2 diabetes. And in good old days, we mostly emphasize on glucose reduction, controlling people's glucose, and everybody gets happy. But more and more realize how important the underlying pathophysiology plays in diabetes pathogenesis and its complications. So by understanding those processes, we might be able to, do several things. Number one is maybe we can prevent the occurrence of type 2 diabetes. But in terms of diabetes management, we have really shifted from purely glucose control to addressing the underlying issues, including obesity, and further to reduction in cardiovascular risk in that group of people. So those are really, really sort of exciting. And what we have been doing in our laboratory, we've been trying to study how insulin acts in people who's going to develop diabetes or obesity diabetes, and how GLP-1 regulated that process, particularly in the vasculature. And we found that insulin action in the vasculature is reduced. And that happens really, really early, and that could contribute to the development of diabetes. And on the other hand, the GLP-1 related drugs can slow down that process or even reverse that process. So potentially down the road, if we understand more and know exactly when to use it, how much to use it, and we might even be able to use this type of medications to prevent the development of diabetes and the complications associated with diabetes, not just simply by reducing weight.
So would you be taking it? That's fascinating. And I didn't realize that you've been studying GLP-1s for 20 years. I knew you've been researching that's a long time.
Yes. You have to love it.
I love it. I mean,
you want to spend so much time on it.
Well, I mean, it's wonderful. And so you'd been studying these for 20 years before they became so popular.
Yes.
So what was that like for you, having studied this your whole life, and then all of a sudden Oprah's talking about it, and everybody's talking about it. I'm talking about like people like me, regular people. What was that like for you?
Well, excited and gratifying.
Yeah, tell me more. How
Yeah,
so?
excited is because we understand much better the underlying physiology behind obesity and diabetes, behind how GLP-1 works and how this type of drug works. And this understanding actually may open the door for endless possibilities down the road. And
Yes.
certainly, gratifying, that's probably easy to understand. Whatever you did contributed to current, enthusiasm and in this class of drugs. And, many people are benefiting from that. And certainly, again, a lot of people understand the importance and emphasize the positive side. And also because I do so much in this in research on this class of drugs, so I also have a good understanding of potentially, the potential negative impact. So sometimes I feel like I need to caution people on the use of those medications. So yeah, excited and gratifying, and also feel some responsibilities as well.
Oh, sure. I appreciate the responsibility because I like to say I think a lot of people, if not most people, are doing them wrong. I mean, they're not emphasizing behavioral change. They're not doing strength training. The doctors don't have enough time to educate patients.
Oh, I see a fair amount of physicians, even without detailed examination of the patient, just write the prescriptions out, and you can actually get it online. You fill in a couple of questions online. You can have somebody write you the prescription, which to me is scary.
It is really scary. You're familiar with Oprah Winfrey, right? She's kind of a force of nature. She's the talk show host, Oprah, the show Oprah Winfrey.
I know her, not familiar.
Okay. All right. Well, Oprah is a powerhouse, and she is a big advocate for GLP-1s. She had a lifelong battle with obesity, and it played out over the media for 20 years. She's like a TV personality that a lot of people in my audience are familiar with. And she's been going on TV lately and really talking openly about how GLP-1s have changed her life and how obesity is a disease, is becoming the new narrative in the zeitgeist. You're hearing that a lot. And me growing up, I didn't used to hear it that way. I didn't used to hear, oh, you've got a disease. It was more like, oh, it's a willpower issue. You're lazy. There's that sort of thing. Just work harder, eat less, move more. Now they're talking about it as a disease. What do you think about that?
Well, I actually believe strongly that obesity is a disease. It's a chronic, recurrent disease. And I believe strongly for several reasons. Number one is in people with obesity, they tend to develop a lot of different other chronic diseases, particularly in my field, diabetes. And people tend to have hypertension, and certainly some, joint issues because of from the weight. And those are, sort of complications from obesity. And this is number one. Number two is it tend to, if you don't control it, it will come back. So if it's not a disease, and typically you get your weight down, you should stay where it is, but it's not. It will come back. So, for this, mostly for these two reasons, I believe strongly that that is a chronic disease. In that regard, I do agree. And once the people lose certain sort of weight, and if they can, maintain other general health, improve their strength, and people are more productive, their life, is more productive and more happier. So yeah, I think it's a disease.
Yes, I agree. It takes some of the shame out of, I mean, so many people struggle with it. Yes.
Exactly. And, the social stigmata has been a huge issue, not only in the past, even now, it's a still issue. And this is particularly true for teenagers and for women. And it has been a lot of social problems. So
If it's a disease, which it is, and people are understanding that more, and thanks to researchers like you who've been studying this for 20 years, would it make sense that, similar to like a blood pressure medication that someone goes on and it treats their blood pressure, wouldn't it make sense that someone who has the disease of obesity is treated with a GLP-1? Would it make sense that they would need to be on it for the rest of their life? Is that why it's spoken about that way, because it's a disease?
it is. So sort of interestingly, you mentioned high blood pressure. People need to be on, and they need to be on medication for the rest of life. And for people with diabetes, and most of them need medications for the rest of their life. But however, if you can address the underlying, sort of pathology or physiology, for example, for diabetes, type 2 diabetes, if you reduce people's weight, improve their insulin sensitivity, and many people actually can stop their medications and keep their glucose in the normal range. So this is what we call something diabetes remission, which is really popular, and the GLP-1 related drug actually has the potential to induce that. So back to your question, whether we should keep people on GLP-1 receptor agonist for the rest of their life or not, and I can't really give you a definitive answer right now. I would say for people who don't have the willpower, so for example, or if they are limited physically, they can't really access, or they have terrible joints, and the people just can't move around. And should you put them on for the rest of their life? I would say to put them on for as long as possible, but in the meantime, you probably should continuously to evaluate the potential negative impact on those patients. Part of the reason why I say that is the clinical trial thus far, the longest one is only a couple of years. I forgot exactly how many years. And less than 5 years, let's put that way. And anything beyond that, what's the sort of positive versus negative balance, the benefit risk ratio, and just need to be continuously assessed. But if they do need that and can't really exercise, I think nutrition monitoring is extremely important.
Yes. I love that you answered that so carefully, and even surprisingly, I'll be candid. As a nutritionist, I believe that lifestyle and behavioral change is probably the most important thing. And a drug, while I think they can be quite helpful for people, it makes me nervous to see people over rely on them. And as a nutritionist, I've seen people reverse or put diabetes type 2 in remission through just diet and lifestyle alone. So in my mind, it would make sense that if you could get your blood glucose and your health markers in balance, you could come off the medication.
Yes, I do that. I do
You
that.
do?
Yes, I do that. I do that in the clinic. And when for people without diabetes, let's move one step forward. For people without diabetes, simply for weight loss, right? They tried some other means, other drugs never worked. And then I put them on GLP-1 receptor agonist. At the meantime, advanced them lifestyle modification. And some people, they are very motivated. Once I know they are motivated, and then I stopped, I kind of gradually titrate it down. When I titrate down the medication, once they reach the sort of negotiated weight goal, and sort of emphasize the importance of continued lifestyle modification, meaning continued exercise, continued watching what you're eating, and observe the weight change. If they, I see the weight holding, I don't want to stop it and,
Great.
and continue to watch.
And do you see for people that like the patients you're describing, the ones that are motivated, the ones that are doing the behavioral change, that are eating well, that are exercising, that are now at their ideal weight, do you keep observing them? Are they able to maintain, within 5-10 pounds for a longer period of time?
It's really in those people who are motivated, yes.
Yes, it's possible.
Yes, absolutely possible, yeah.
Yeah, I love that.
Yeah.
Good. That makes me so happy. I'm seeing that too. And it's hopeful to hear researchers and physicians, also talking about that, because the standard of care, you'll often hear physicians just talk about that they're going to need to be on it for life, period, full stop.
Yeah, I'm always nervous about, taking those things for the rest of your life. I'm always nervous about that.
Yeah. Good. Yes, behavioral change, so important. Thank you. I really appreciate our conversation today, Dr. Liu. Thank you so much for sharing your wisdom with us. This is so good. Where can people find you if they want to learn more about your work or follow where you are, University of Virginia? Where do people find you?
Well, I think my information is everywhere.
Okay, good.
Because I have a lot of publications and I have my email. And also, I used to use Twitter, and not as much as anymore. But email, and they can follow me if they want.
Okay, wonderful. Well, we're going to post this podcast, and we'll share your information in the show notes.
Yeah, that's fine.
Thank you so much for being here.
Yeah, thank you.
I really appreciate you, and we'll say bye for now.
Okay, bye now. Bye-bye.